Good afternoon, everyone from around the world. This is Mike McGee. I am with Real Talk, Real People, Real Situations. And today, we have a good one for you today. I am going to bring in the president of the National Acupunctural Detoxification Association, that is called NADA. And we're going to talk today about holistic healing. Now, NADA trains people in the NADA 5-point protocol, an ear acupressure and acupunctural intervention for trauma, for substance misuse, abuse, dependency, and related behavioral and mental health conditions. Together, we're going to discuss and promote and also advocate for the access to holistic care as a right to all community members. And I would like to bring on today our guest, Dr. Kenneth Carter, who is a psychiatrist, but I want him to tell you a little bit more about himself. Dr. Carter, how are you doing today?
Good morning, Mike. Good morning, Mike. It's an honor to be here. And
right.
Yes, sir. Yes, sir.
Yeah.
So I always like to begin by giving honor to God and to all of my beloved ancestors who have made my personal mind, body, spiritual, and professional healing a possibility. I started in my career in pursuing medicine after high school at Johns Hopkins University as a pre-med, and from there went to medical school at Rutgers in Newark, New Jersey. It was there that I started my formal continue my pathway toward becoming a physician. But interestingly enough, man, about halfway through, I wasn't really feeling it because it didn't really bring forward that sort of spiritual component, reflecting my own culture, my own history as a Black American of African descent here in the United States. So I studied extensively, not only in medical school, but also outside of it, at the Institute of Self-Healing with Brother Ishmael Jamal, a remarkable individual that I encourage everybody to really look into his work. He organized the first all-African holistic conference at Martha's Vineyard. There had not been one before, bringing in healers from Africa, South America, across the United States. But he directed me. He was the one who directed me to another ancestor that I really hold high and who has recently made his transition. May he rest in peace. His brother, Dr. Mutulu Shakur.
Oh.
Recently making his transition several weeks ago. Again, may he rest in peace. Yeah. Holding him up in divine light, my brother. But the reason why I mentioned Dr. Shakur is that he was a major force behind what developed at Lincoln Hospital, the Lincoln Detox Center, bringing in acupuncture to address what was a raging heroin epidemic in the South Bronx through the 60s into the 70s. And it's very interesting that as working very closely with the Black Panthers, the Young Lords coming out of the new Africa movement, and really wanting to help the community to deal with an addiction problem that was rooted in a whole host of socio-economic ills, pressures from all sorts of directions, from every direction you can imagine. Initially, the brothers brought in the methadone as a replacement treatment, but after a year or so, really started to bring in and develop acupuncture to address the issues of opiate use disorder, opiate addiction, and dependency. They were the first ones to ever bring in acupuncture in a treatment program setting.
Wow.
And they brought that in the early 70s, 72, 73. I came through about a decade later in 1982 having completed my sophomore year in medical school, and really just going on a quest, man, just trying to find something that would speak more to the issues that I was most concerned about. I remember one of the most compelling things that really made me even doubt if I wanted to complete a Western medical education before I went to the Lincoln Acupuncture Recovery Program in the South Bronx, that was founded by Dr. Shakur. Um, my concern was that there were articles in the New York Times at that time identifying that a black man in Harlem would have a lower life expectancy than a man living in the poorest country in the world, in Bangladesh at that time. So I was looking for answers, a way to go. When I got to Lincoln, unfortunately, Dr. Shakur was not there, but the medical director at that time was a Dr. Michael Smith, who was the lead clinician in their treatment program. That was an addiction treatment program. And so he has made his transition as well. I hold him up in the light as one of my key triumvirate of mentors that really turned on a spark in me to continue as a physician, but not as one who only studied to become a physician, but that entered with the idea that it needed more, it was incomplete, and gave me the tools to begin to bring that into the medical profession. I specialize in psychiatry. In 1982, I was practicing acupuncture before I became a physician. So I did not have to be convinced through literature reviews and waiting for the research to come out. I saw it with my own eyes. I'll tell you about the first patient that I ever treated with the acupuncture. And this was way before I became a comprehensive acupuncturist through the NCCA-OM, which is the body that certifies full body acupuncturists. But I will still say that it was my time at the Lincoln program there in New York that really transformed me. The very first patient I ever treated that they sent to me was, and knowing of my interest in mental health and psychiatry, was a brother who was addicted to crack cocaine with a severe comorbidity of schizophrenia. And he came into the clinic. He was hearing voices, command auditory hallucinations to kill himself. And when he comes into the clinic, I'm recently trained, and the training at that time was a 2-week training, very much experiential, hands-on, in a clinic that was treating up to 200 people a day. So it was a lot of volume, a lot of good energy, heavy activity. And even though it was a rather noisy place at times, it was still total peace at the same time, if you can imagine that. So the first brother that they had me treat, crack addicted, schizophrenia, had been out smoking crack all night, comes in having hallucinations telling him to kill himself. And so I'm not even a physician yet, so I'm nervous. I'm like, so if I, approach this brother to treat him with needles, he already wants to kill himself. What's he gonna do to me? You know what I mean? So, but he reassured me of just how valuable the program was to him, how much benefit he had gotten from it. So I treat him. He falls asleep. He wakes up about a half an hour later. It's a completely different person sitting in front of me.
Wow.
When he came in, he's anxious, he's restless, he's got all the associations of being overstimulated with what cocaine can do. He wakes up, his whole demeanor had like changed into one of much more calmness and peaceful looking. His speech was much more regulated. This is a person you can have a conversation with now. He was still hearing voices, but they were not telling him to kill himself. And he went on to explain why he keeps coming back. He keeps coming back because number one, it's welcoming. It's not a sense of being judged. It's not a sense of feeling rejected. It's open doors and total love. That's the first thing. He also mentioned that he comes back even though he wasn't ready to go into a formal treatment. This could be considered as a harm reduction strategy in the meantime. He said, hey, when I know that I'm going too far, I come in and get a treatment and it helps me. Eventually, he did come into treatment, take advantage of the psychosocial components of care. But it's that scenario that really inspired me to work with SAMHSA and the Centers for Substance Abuse Treatment when I was invited as a co-author on tip number 45. TIP stands for Treatment Improvement Protocol. This was SAMHSA CSAT's flagship publication on detoxification and substance abuse treatment.
Wow.
I pretty much wrote pages 102 to 105, if anybody wants to check it out, on that for the first time recognize what was then called an alternative medicine as a best practice in the United States. The very first time it was this protocol, the National Acupuncture Detoxification Protocol, and where they hung their hat in terms of that recommendation that it ought to be included in detoxification and substance abuse treatment as an adjunct to usual and customary treatment. Where they hung their hat was exactly where this brother had educated me over a decade before, that it helps with engagement, it helps with retention. And what's most important with any sort of a healing path, healing process, healing program is who keeps coming back. If your program is not welcoming enough, if you don't have a structure and a protocol so that your patients feel welcome, engaged, they want to keep coming back, they're not likely to do so. And those are the ones that are most likely to relapse and have the worst outcomes. So the NADA protocol has been an anchor of my treatment, of my work as a psychiatrist. I've worked in many different settings, from inpatient, outpatient. I mentioned with governmental bodies and organizations throughout the years. Right now, I'm a lead psychiatrist for the integration of mental health into primary care, and as a clinical educator for the implementation of whole health techniques, of which acupuncture is at the top of the list in the veterans healthcare system.
Wow.
We do teach other sorts of modalities as well, including Tai Chi, Qigong, dietary advice, yoga, those sorts of things. But the unique role, the very unique role that the NADA protocol can play is that you don't have to have the sort of motivation to be able to pay attention, to learn a Tai Chi set. You don't have to have the motivation and the mental ability in the throes of withdrawal, in the throes of severe depression or severe anxiety that makes it very difficult to learn a mindfulness-based stress reduction technique and pay attention to that. With this protocol, all we need you to do is sit in the chair and allow us access for either needles for those who, and we also include other techniques, either by way of preference or by way of even augmentating the needles, using acupressure devices, such as my favorite is gold-plated magnets that we place at certain points in the ear that correspond to energetic centers within your brain and your body, and helps to promote healing and balance in that way. We also teach the use of simple touch, or simple acupressure techniques with the appropriate intention and knowing just very simple things about how to accomplish this, you can do a lot. So it has been the staple of my professional practice ever since before I became a physician and first learned the protocol back in 1982. So
So for those who don't know, you have the 3 and 5 point protocol. Do you work on the 3 point, or it's just the 5 point protocol? And what is, for those who don't know, explain to
yes.
them exactly what is the 5 point NADA protocol.
Yes, yeah. The not a 5 point protocol addresses the use of five points within the ear that are invariant. So we use 1 to 5. So a better way to say it is really a 1 to 5 point protocol that is used.
Okay.
And over the years, we have learned from our patients that most people, many people do as well with 3 specific points within the ear as they do with 5. Just like we've learned that many patients do just as well with the acupressure points. Um, Wanting to hedge the bet in every way I can when possible, I will usually use both the acupressure and the needling in a specific encounter, or to be included in a program if I'm called in as a consultant to help to set up a program, or in our educational settings, because we want our practitioners to learn all of it. But the treatment is very patient centered. And so, what I do now is really start off treating a group, say, of anywhere from 15 to 20. A single practitioner can treat 15 to 20 folks within an hour. I'll start off with the acupressure using the simple gold plated beads on the ear, do the group, and then come around and ask who else would also like the needles. Most of the times, folks want both. Sometimes people, and you can see it, they've gotten a robust response simply from the acupressure. So we mix it up in that way.
Okay.
And the other thing that is important about the protocol is that we do promote it within a healthcare system, or within a practice, or in traditional medical treatment as an adjunct to usual and customary treatment. We also use it, however, as a population-based tool that is meant to be in the hands of individuals in the community who are doing grassroots work, hands-on work in the community. Many of our practitioners are going out into parks, working with families. One of the most gratifying experiences that I have is in working with those in the faith community who might want to include this as part of a ministry for those who are sick and shut in, for those within the congregation that might be veterans suffering with things like PTSD. There's a literature that this helps a lot if you give it early, to really even to mitigate the development of PTSD symptoms. Helps you to sleep better, helps to decrease anxiety, you feel more calm, more relaxed, and thus you have the energy and the ability to be much more productive in your own life, in terms of whether you're in a treatment program, or whether you got to go to work, or whether you have to come home to your family and be there for your loved ones, for your wife, for your children. It really helps with all of that. And much of this can be used in a manner of self-care. So we teach folks how to use, especially the acupressure, to use it even for themselves, where you don't need that degreed professional to be able to provide it to you.
Got you. So before we go further into the discussion, because there's a lot more that we need to talk about, got to pay some bills. So let me go ahead and put my sponsor in real fast, and I will be back in about a minute and a half. Okay?
Great. Okay.
All right. And we are back with Dr. Kenneth Carter, who is a psychiatrist, and he is the president of the NADA protocol, the NADA, which is the National Acupunctural Detoxification Association. So, Dr. Carter, just to keep going on with the conversation here, I understand that the U.S. and Canada and many locations encourage the implementation of the NADA program.
Yes.
However, how does the state and national laws differ when it comes to providing this service that is really needed for the communities?
Yeah. Well, there is not a national law at this point.
Okay.
So the laws that are governing the practice are state-based, and they vary widely. They vary from those who do not require any sort of licensure to practice at all, to those that are more strict and only allow a physician or an acupuncturist to practice, a comprehensive acupuncturist. And there are those that are in between. And about half the states do have a law. Many do not have a law at all at this point. And so those are gray zones as far as the areas of practice. In
But
states,
can you still practice in those gray zones? I mean, or can you still provide a service in those gray zones?
well, if you are a physician or an acupuncturist, there is no question.
Okay.
And otherwise, you're confronted with what the Black Panthers and the Young Lords were confronted with in the early 70s, where even though there were no law, they had a tool that was valuable. They knew there was a community in dire need, and they did it anyway. So, in that sense, in those sorts of situations, I highly recommend to speak with, to make sure you have community support, that you have the support of those in the medical community who understand what you're doing. And it would be great if there was support of someone in your governing body or legislative body to support as well, because because that helps to say, hey, even though the state doesn't have a law, this is as reasonable as taking a glass of water, and nobody tells you to drink enough water every day. You don't need a law for that, and it's simple and easy in that sense. And the states that have the best laws are those that are most permissive, that will allow you to practice simply with the training that you get from us, from the National Acupuncture Detox Association. You're in Maryland, and in Maryland they have a favorable state law that allows you to practice as part of substance use treatment. In other states, there are laws that specifically say you can practice for either for substance use and and in areas of mental and behavioral health. It works for all of it.
Gotcha.
I like to harken back to the example I gave of the young man that I first treated. Imagine this. This is a gentleman with schizophrenia. So now you're talking about severe, persistent mental illness. The protocol works with that. He described it in unquestionable terms, the benefit. He was addicted to crack cocaine, so we know it works for that. But over the years, we found that it doesn't matter what the substance is. It can be legal or illegal, prescribed or not. Even many of the psychiatric medications that we prescribe to folks can have withdrawal symptoms. Um, and Medications such as Effexor, Paxil, those with short half-lives, you're talking about Valium, Xanax, those sort of medications. We're talking about the mood stabilizers. All of them can potentially have side effects, all of which side effects can be reduced, mitigated, perhaps eliminated through use of the NADA of the protocol. And certainly in using the protocol, what we find is you get more benefit if you have to be on medicine at a lower dose, which means less exposure to potential side effects. If you're
Wow.
Yes, sir. So if you're part of a treatment program, I mentioned in 2006 when we were the first alternative complementary holistic practice identified as a best practice, it helps with engagement and retention. That means that in any substance use program, regardless of whether it's a methadone program that is treating, regardless of whether it's a treatment for alcoholism, or even these substances for which there is no medication assisted treatment, like methamphetamine, like cocaine. It helps to support the patient. It makes the job of the practitioners easier. As I described, if I had tried to interview that first young man that I saw as part of my 15 years working in dedicated psych emergency room, uh, we probably would have given him Ativan and Haldol, which it probably meant he would have had, it may have been a struggle to give him medication against his will since he wanted to kill himself, and we could not let him leave even if he wanted to. Then he falls asleep. Now you're talking about 5, 6, however many hours down the road, and he doesn't have the sense that this is a place I want to keep coming back to. It's not so warm and friendly as what we can set up using the sort of groups and education planning structure that we can set up with the NADA protocol.
So, with what I'm hearing you say is that this is a better holistic intervention than the medications that is put out. And you are a psychiatrist.
Yes, sir.
You are a psychiatrist who, where medication is something that most psychiatrists literally push, right? But you're looking at this in a whole different format. You're looking at this from a community healing, not a community adaptive type of treatment. Like you can be addicted or adaptive. You can adapt yourself to a drug, but you're really looking at the core of how to heal the individual. That's what I'm hearing.
I like what you're saying, and I'm going to reframe it a bit.
Okay.
In that, if I had not been introduced to Lincoln and the wonderful work that Dr. Shakur has promoted, that Dr. Smith has promoted, that I would have been a regular psychiatrist, and the strongest tool in my toolbox would be a medication tool. Yeah. And if you got a hammer and all you got is a hammer, that's what you're going to use. Gotcha. So that's how I think about it. The other thing is that when I was coming through in psychiatric training, at Rutgers, at Columbia in New York, psychodynamic psychotherapy was still in vogue. And if that's all I had, then as a therapist, then I would use that, and it would be a talk therapy. So if all you got is a hammer, that's what you're going to use. I will say, though, and again, I'm not here representing the veterans healthcare system today, but I just want to give them props and a big up, because when I was asked to consider coming there, I guess 5 years ago, well, actually about 8 years ago now, I've been actually working with them about 5 years. I was pleasantly surprised that they have their arms wrapped completely around the idea of holistic health and bringing holistic health modalities to our veterans. Why? Because they recognize, quite frankly, when it comes to life and death, our veterans coming back from theater of war were dying more here in the United States than they were in theater of war, from opiate overdoses, from various addictions, from various things of that nature. And they were insightful enough. And this is, again, I'm speaking for myself, but they were insightful enough to begin to realize what the Panthers and Young Lords realized 50 years before, that we need something more than the usual and customary treatment if we're going to reach everybody, specifically reaching those that may have the disease of addiction and substance use disorder. So I'm just very glad to be there and being part of the team that's leading the way in introducing this there. And from there, we're very hopeful. Like you had asked, is there a national law? We're very hopeful that once the veterans healthcare system adopts this, that there will become a national law, or at least a national scope of practice. Once those in the field that may not be as familiar, and all they have is a hammer, you learn how to use a different tool as an adjunct that can lead to better outcomes.
So I'm what I've noticed is here in America, it seems like we do have a few things going on when it looks at holistic healthcare, and then you also have a lot of the Eastern countries as well who live off of a lot of these holistic healthcare ideologies, right, or treatments, interventions. How has NADA influenced international medicine?
Well, it's interesting. And I mentioned to you that before I left medical school, one of the things that really told me I have got to find a different tool to augment what I do was the stats about a black man in America. And to be quite frank about it, we know that black and white is real. And black folks across the globe run into what is essentially a pigmentocracy. The lighter skinned you are, the closer to white you are, the more access you have to a whole host of treatment modalities and resources and all sorts of things that those of us that are at the different end of that pigment scale may not have access to.
Mm-hmm.
So, what Dr. Shakur has established at Lincoln, and what Dr. Smith helped to propagate and promote, has really helped to lift the respect of the black man on a national scale. We created this. You're talking about the Black Panthers and the Young Lords, even though they work very closely with white physicians and others in the community that were very, very supportive. Dr. Matula Shakur was black. Dr. Michael Smith was white, and so it's not a black-white thing in terms of wanting to exclude anyone. But we all know that many of the accomplishments of blacks through history have not been acknowledged, have been ignored. And we have been determined here at NADA to make sure that this history is not forgotten or lost.
Wow, that is amazing. Is there anything out there that a person who wants to know more about NADA? I've actually I got your phone number up online now.
Great.
I also have the email here. But is there any other entity that if a person really want to view the history of NADA or anything of that nature, what should they do?
Well, I like what you have here. Check out our website. I think we're the most comprehensive repository at this point of that. I'd encourage them to Google my name, look at the publications that I've produced. Google the name of Dr. Smith. He has a number. Is Michael Smith. He has a number of articles, publications. The one I really pushed the most, though, is an article that was co-authored by Dr. Matulu Shakur and Michael Smith in 1979 that really articulated the use of what we now call the NADA protocol, but it was the first article that addressed the use of ear acupuncture, acupressure in a substance use treatment setting. I would highly recommend that because it lays it all out. It's our origin article, if you would, and everything that I've written that through the course of my career has that as a foundation. So,
wow. Now I understand there's a movie out there as well.
Oh yes,
about that as well.
Yes. Thank you for reminding me about that. The movie is dope as death, and it's readily available on YouTube. I'd encourage you to watch that. Yes, thank you for reminding me of that, and perhaps even start with that first because that will give the whole history in a way that the written articles just don't, because we're writing for a peer-reviewed professional audience for the most part, and so often you can't say everything that needs to be said just like it needs to be said. But in Dope is Death, it is very clear about the socio-demographic pressures, stresses that the Panthers and Young Lords faced in the South Bronx, the fact that they were never welcomed by the hospital system in general. And so all of this was in the face of a lot of pushback. And so which even leads to the reason even more that now that it is gaining widespread acknowledgement and acceptance, we don't want it to be lost and whitewashed. We want the history to be clear about where this came from. And just like with the everybody knows the story about the music and how much of that had been stolen. And so this is the same way. We have to make sure that we tell our story.
Gotcha. So
Yeah.
I'm going to go to another sponsor break real fast. Okay.
Yes,
and then we're going to come back and we're going to conclude. We're going to ask you a few more questions and then we'll conclude today's discussion. But I do want to invite you back because there's a lot more that we probably would not hit on today. But we definitely want to have you back because this is getting very interesting. And I think there's a lot of my viewers around the world who would like to know more about what you have to say.
Great.
So we're going to go right to a sponsored break right now. Okay. Welcome back, America. Welcome back around the world. This is Mike McGee with Real Talk, Real People, Real Situation. I am with Doc Lowe Mental Health Research Firm, and I'm talking today with the president of the NADA, which is the National Acupunctural Detoxification Association, Dr. Kenneth Carter. We have had a very great conversation today so far. But I do have a couple questions because I have a few people who are very interested in the empirical studies that has been done around the NADA protocol. And for the mental health educators, what is the evidence base for acupunctural detoxification?
It is strong and unequivocal. As I mentioned, CSAT SAMHSA, almost 20 years ago now, identified this as a best practice for engagement and retention. I encourage you to get that publication. They will mail it to you for free. It is tip 45.
Wow.
Yes, sir. The other thing, I urge you to simply Google the NADA protocol, and you will find a wealth of articles. If you pull, one of mine was mentioned within the American Psychiatric Association textbook on substance use disorders, on the use of the NADA protocol as an adjunct to usual and customary treatment in order to improve outcomes. And so I encourage you to look at. There are lots of good references there. Also, there are a few that address the use of acupressure, even in terms of helping the course of COVID and COVID-related symptoms. So the evidence is strong, and I encourage you to simply Google my name, look at and jump into the extensive references that are there in both my earliest and more recent publications. If you go to the website, you will also find a lot of references there.
Okay, perfect. Now,
Mike, if I could,
sure.
I'd like to add though that in terms of the peer-reviewed literature base, I was encouraged after I finished my psychiatric training at Albert Einstein and Montefiore in New York. At Montefiore, I was actually chief resident on a psychopharmacology unit. So I'm not saying that all psychotropics are bad. I just think the world is upside down. We use too much of the pharmaceutical psychotropics and not enough of I think of them as ancestral wisdom healing techniques like the acupuncture and the other holistic modalities. And so also I really want to push the article from 1979 published by Dr. Shakur, and Dr. Matula Shakur was Tupac's stepfather, Tupac Shakur, and published by Dr. Shakur and Michael Smith, because there is one thing about, randomized controlled trials. We want that. But like most things, there's an ancestral wisdom that goes over thousands of years. That is evidence too. The evidence that the Panthers and the Young Lords and those who inherited their work, what they did in the South Bronx over thousands of patients over many years, is evidence as well. So I encourage you to look at that article on how they got started, the situations that they were faced with, and still they came out like stars. So I really encourage you to include those that are interested in the literature base to take a look at those. I'm glad you've included the email there. I'm happy to share information, have a conversation with anyone who would like more. So
that is awesome. And as we're looking more at the evidence base, my research that, because this whole podcast is all about mental health research, mental health interventions, and things of that nature. So we look at it from so many different dimensions or paradigms. Yes. So my research focuses on the traumatic experiences that pregnant women go through without the proper community supports and how the lack of these resources can affect the unborn child. Now,
Yes.
so are not treatments safe for the pregnant woman as well as that unborn child who's still going through development within the fetal psychological, the fetal development?
Absolutely, and there's not a question about that. Outcomes are better when we use the sort of adjuncts like the ear acupuncture that can help them engage and be retained in, in treatment. There have been no adverse outcomes associated with use of the acupuncture protocol in pregnant women for them or the children. In fact, the babies. There was an article out of Stanford where they treated neonates with the acupressure using one point, that the Shin Men point on the ear for neonates of mothers who were opiate addicted when the baby was born, and it helps the babies in terms of detoxing more quickly, helping to stabilize more quickly. So no, that is not an issue at all in terms of any expectation of adverse outcome with the pregnant mother or the child. So
Got you. Now there are 5 points in the ear that is either pressured or punctured somehow. Correct?
yes, yes.
Um, can you explain to us what all 5 points and what each point does?
Yes, and the explanation that I'll choose to go through now is a functional one
Okay.
versus a physiologic neurotransmitter driven one. The functional one, we use the 5 points. We use the sympathetic, which is for tension and relaxation. Hitting that point will often drop all this tension. It just calms down.
Mm.
There is the Shin Men that is also referred to as spirit gate. That really helps with mental clarity, with concentration and focus. It's a master point that is used for many different conditions and can have a broad range of effects, and really speaks to why we don't tell patients what they're going to experience when we treat them, because we often get surprised. They speak to body aches and pains that are relieved. They speak to sleeping better, all sorts of things. So it's a nonverbal treatment where we let the patient go in and experience what they do. The third point that we always include is the lung point. The lung point is related, actually is in the lower half of the ear that is innervated by the vagus nerve. That point is we associate with relief of depression, sadness. But we also know that with the vagus nerve, it innervates everything in our interior. So it helps to regulate blood pressure. It helps to regulate anxiety symptoms, helps to regulate your HPA axis. That's enough I'll say about that for now. We also use the kidney point that is related to fear. And whenever we're talking about a habit change, it can be a scary thing if you've been used to having a substance to help you get through your day-to-day stress, alleviating all sorts of anxiety. To talk about stopping that, the kidney point can help to support that. And we treat the liver point that is related to anger. And so many have issues with anger management, either around the issue of substances or just related to the endemic sorts of institutional racism that we have to deal with as Black folks here day in and day out. Not that we're the only ones, but all you have to do is look at the news and see that ain't gone. It's still there and it's strong. So those are the 5 points: the sympathetic with that sort of muscle tension and release, the Shin Men that helps with the mental clarity, attention, concentration, the lung related to depression and sadness, the related to fear, and the liver related to anger and irritability, anger management. So.
Now, I know I'm going to get this because I got my email out there too.
Okay.
I'm going to get this question for the parents. And now, my understanding, anyone can be trained to become, so you don't have to be a healthcare worker or any of that, anyone can be trained?
Well, I have a caveat there,
Okay.
and I've been accused in the past of encouraging people to go to jail. That is not
Okay.
true. I do not encourage folks to go to jail. But what belongs to what is real in terms of how human beings work, and what belongs to Caesar and laws and state laws is two different things completely.
Okay.
And the way the Panthers and Young Lords did it was that they trained folks from the community. My most impressive acupuncturists I've ever trained with didn't graduate from high school. Didn't hear me, did not graduate from high school. So even though I have an alphabet behind my name, I carry it with great humility, because the things that have really helped me to be most satisfied with my path as a psychiatrist did not come from the alphabets. It came from stepping outside of that and working with individuals, some of whom did not graduate from high school.
Mm.
So there are state laws. What's real is that you can train anybody to do it. A child can learn how to do the acupressure points in 15 minutes. If you go to our website, you'll see various tutorials on the acupressure. Anyone can be trained to do the needling, and we have a intensive 3-day training where we can come into programs, train individuals to do this in 3 days. You still need to practice. If you're going to be, it's great to be part of a treatment program, but you can learn how to do it and take it back home to your block, take it back home to your hood, take it back home to your church. And with continuing access to mentorship, that's enough. But there are state laws that are highly restrictive, and that say that only a physician can do it, or only an acupuncturist can do it. I would remind people that at the beginning of what really was the beginning of Western, what we know today as biomechanical Western approach to medicine, really started around 1860, closely associated with the hypodermic needle and the development of going from opium to heroin in a situation of war to address pain. At that time, they said that only a physician can use a hypodermic needle because they got to know. Now we know that we train, phlebotomists in a hospital to do it in a very short period of time. So a lot of the laws that are restrictive, I really believe, is because there's a lack of familiarity. There also is a contingent, though, that is trying to protect turf. For instance, the NADA protocol has had the most difficulty in states where there are the most comprehensive full body acupuncturists, because they tend to, either through lack of understanding, see it as somehow some sort of a competition. States like California, Florida, and North Carolina, and I have taken them to task. I feel they should be embarrassed by trying to block the propagation of this very simple protocol that is meant to be in the hands of the people. They should be embarrassed. But I'm very grateful to also be able to speak to that as a comprehensive acupuncturist myself. So there is no comeback when we look at the science, when we look at the reality of how it's been used and the track record. There is no excuse except self-interest for trying to limit access to this.
Wow. Now, I'm going to ask you 2 more questions here. The first one is going to follow up about what can we do
Yes.
as a community to help push this forward? Because it seems like this is a holistic way of healing the community.
Yes.
Right. So what can
Yeah.
we do right now? You said a young lord. You said
Yes. Well, yeah. Well, I'm so glad you brought up the excellent documentary "Dope is Death,"
okay.
because for me, having speaking back to what the situation of over 50 years ago, to me, is respecting our ancestors. We have to respect our ancestors. They did it. They got it started. I encourage you first to watch that documentary, show it to everybody you can possibly get to see it. It's very instructive, very powerful, and I'd really encourage that because if you're first becoming familiar to it with yourself, perhaps inspired by anything that we have said today, the question is, how do you go out and, as you said, how do you support and promote it without really knowing the deep history and what's behind it? Dope is Death is an excellent start. Other than that, our organizations trains trainers. So I'd encourage you to consider becoming trained first yourself as an auricular, as an acupuncture detoxification specialist, which only involves 5 points within the ears. Get trained yourself, become a trainer. And I hope that folks are hearing the passion that I have for this, and I've always had for it. I'm available to you as a resource. I know that our members within NADA are passionate about this just as much as I am, and we can help you find someone who is local. If not, we'll come to you. And we have spread across the world. I've been to Africa 3 times myself and conducted the first training in Lagos, Nigeria, at the Psychiatric Institute there. Wow, this was back in the early 2000s. So we have introduction there in Kenya, South Africa, in India. It has a deep penetration in many of the European countries. And we're growing in South America, Central America. So just reach out. We can find a way to support you.
And I know that the parents and the caregivers don't need any more reasons of not okay to look up Dope is Death and to follow this, right? But I want to ask you a question that I think a lot of the parents are always asking as well, right? There's Seneca is just so many different intervention options that this can work towards different diagnoses, right? So holistically. So I'm going to call a few. Let me know if any of these does not work with the NADA protocol. Okay.
All right.
ADHD.
It works.
All right. How about oppositional defiant disorder?
It works.
Conduct disorder.
It works.
Autism.
It works.
You said schizophrenia.
Yes, sir. It works.
Psychosis.
I'm going to leave you with this phrase because I like the list you're going down. I like to throw out the idea of something that is transdiagnostic.
Okay.
Transdiagnostic. This protocol does not depend on a diagnosis. And if we look a bit at how the ear develops before you have a brain, before you have a heart, before you have a nervous system. So it is upstream of virtually everything.
Wow.
Everything. So that's how we think about it. Now, and in saying it works, I'm not saying that it should be used exclusively. Gotcha. But for many people, it may be enough. I remember the textbook of psychiatry when I was in training specifically was saying that what they had in psychiatry did not work with oppositional defiant disorder, with the sort of conduct disorder stuff. They even specifically called out issues with those sort of behavioral issues in African American communities, specifically saying that organizations that could look eye to eye, that really could feel the population, that were culturally competent, like the Nation of Islam, like the Black Panthers, they were called out specifically in the textbook, were those that were most likely to be helped with those sorts of things in our community. So more than anything else, the protocol and gives us an ability to spread love, because you don't have to talk. It doesn't take an explanation. All you need is access to somebody's ear and have them sit in a chair. That's it, And from there, with the internal change, now they got an ear to hear other things. And someone with, say, you mentioned schizophrenia. I would never think of this protocol as a sole treatment for schizophrenia, but it's very clear that it can have a very important role in terms of stabilization, of allowing the lower use of medications, less exposure to side effects that can cause irreversible issues like tardive dyskinesia. That's an irreversible outcome of some of our antipsychotic meds. We can decrease the risk of all those things. So I'm gonna let you keep going down the list, but I just wanted to get that in.
So I think what I was really going at is because the generational trauma, we talked about respected ancestors, things of that nature, and there's a lot of different diagnoses, right? That is lined up with what we call generational trauma, or generational curses and things of that nature, you know. So what I'm hearing is that this is good for genetic disorders as well. Right?
Well, and I'm glad you raised that point, man, because I was advised, with my passion about this and knowing it would be an uphill fight back 20 years ago, within 30 years ago. My God, it's approaching 40. but I was advised that with the passion, what I want to do, I need to be able to write the books, not just read them. Exactly. So I was advised to. So I have the MPH that I have is from Columbia University, and the holy grail of psychiatric treatment is prevention. And how do we deal with these sorts of intergenerational issues? Exactly what your research is addressing, Mike, is wonderful. And the idea is, where do we have a tool that is widely available enough, simple enough to use, that you can penetrate a population, not just one doctor, one patient in one room for an hour, but how do you orchestrate public health oriented, population-based care? I don't know of a better tool, and for that than this. I really don't. So.
Well, we only have a few seconds left. Just want to make sure I got the website, www.nada, N-A-D-A.
Yes, sir.
.com. All right, I want to put it out there for everyone to see that. I just want to make sure they got that.
Mike, the previous screen you had was correct.
Okay.
It's www.acudetox.com.
Okay, Acudetox.
Oh yeah. And so you have the right ending there for the office.
Okay.
But the website is www.acudetox.
Okay. Sorry for that. I'll make sure that we correct that, because you're coming back, right? I would love to have you come, because we have so much more to talk about.
Yeah. That sounds good. My brother.
We have so much more to talk about. And please bring back friends as well.
Sounds good.
Okay.
As a matter of fact, I would look forward to bringing the vice president of the organization. His name is Dr. Warren Leggett. And I tell you, he's opened the path for me at Bowie State University, which is the most comfortable I've felt in any academic institution in my career. They have rolled out the red carpet. He is doing great work there in facilitating this, promoting it, educating the academic community, the local community. So I would certainly like to bring him back the next time I come on. Thank you very much for the invitation.
And no problem. And for the viewers to know that although I know you said I'm in Maryland, you are where? Where are you at in the world?
I am physically located in Florida. Okay. And as I mentioned, I'm here. We're working with the veterans, with the VA at Bay Pines, which is very close to St. Pete. We're right across the bridge from Tampa. So yeah. Awesome deal.
So that lets everybody know that we are not just talking about one state, not just two states,
right.
But this is a nationwide search to get people on board to move forward with this holistic healthcare. Am I correct?
That's right. It's a movement. And I'll tell you, within the VA, who really is, from a mainstream Western perspective, they are leading the way. They're speaking about it as a revolution in healthcare.
I love it.
And one of the messages that I'm determined to bring forward is that this revolution is 50 years old. And like most revolutions, it starts out with blood, sweat, and tears. I mean, there were people who died bringing this forward. Dr. Matulu Shakur himself sacrificed so much in order to promote and to see this move forward up until his dying days. So it is a revolution in healthcare, but as my mentor of many years that I mentioned through the Institute of Self Healing that directed me to get into this. Long ago, he used to say there's nothing old under the sun, but there's nothing new under the moon.
I
They
love
keep
it.
coming back over and over again. So this is a resurrection of sorts of our ancestral wisdom, and I'm so happy that this protocol is part of that and is helping to lead the way. So
I love it. Dr. Kenneth Carter, psychiatrist, acupuncturist. We want to say thank you for all the hard work that you have done in this field, being a pioneer, because you are definitely a pioneer as well in this field. And we're looking forward to having you back. If anyone wants to get more information about NADA, please, the phone number 888-765 NADA, which is 5232. You can also be reached by email, which is the NADA office at acudetox.com. NADA office at acudetox.com. And the website is www.acudetox.com. Did I get that right?
yes, sir. Yes, sir.
All right. We will be promoting this on all of our streaming services as well. It is also going around the world. We want to say thank you again for coming in. I've got to pay the bills. I got one more sponsor, but other than that, I want to put you in the green room and we'll talk in a second. Okay.
Great. Okay.
All right. Thank you so much.
Mhm.
All right. Once again, we want to leave you we want to leave you again to say thank you, Dr. Kenneth Carter. He has been very inspirational. This is a movement that we're asking everyone. If go to your congressman, go to your Congress, go to your legislators. Let's talk about this. This is a way that we can heal the community. This is a way that we can use this technique as an adjunct to other interventions. This has been Mike McGee with Real Talk, real people, real situations, and you are listening to the Doc Lobe Mental Health Resource Firm podcast. Once again, thank you again for coming in. Thank you again for joining us. All right. I think that's it.
All right. Okay.
Thank you. I hope everything, how did everything go for you? Everything was good?
I'm very self critical and
Uh-huh.
thinking I'm talking too fast or stumbling or
Oh
over
no, you did a
myself.
good job. You did a good job. Just want to let you know. I'm the same way. So I
Oh,
hope,
okay.
yeah. I'm
Plus, I
real.
get to stutter in there in my younger years, when before for a long time, man, I could barely get a sentence out, man. When I get excited, it starts to come out again. So,
I get it. Hey, no problem. You did a wonderful job. It was everything was very clear, crisp,
sounds good.
understandable. So once again, thank you
Great.
so much. Okay.
Okay, man.
And
Good.
I will share this with you.
Good. When's the next one?
About a month from now
Okay.
will be the next episode.
All right. Okay,
I'm
my
doing
brother.
it once a month now. I might be going down to every 2 weeks. So once a month right now.
On another note, when you have time, I'd love to talk to you about your experience in Africa, man, on the
Oh, man.
continent.
Yes.
No.
Yeah, let's sit down and talk about that. It was a wonderful experience.
Yeah. So give me a call and let's
Okay.
chat about it, because I'm heading to Egypt
Oh,
in November. Annette and I. So looking forward to that. And plus, as I mentioned, I've been to several countries in Africa.
yeah.
Just wonder what your experience was with keto
Oh,
when you went, man.
yeah, I would definitely. Let's sit down and talk. How you look like tomorrow? Are you good?
I'm good tomorrow afternoon. Let's
Okay.
say late afternoon, evening is good.
Okay, for about 7. It's okay.
Yeah, that sounds great. That sounds great.
All right. Let me see if I can give you a call around that time.
All
And
right,
let's discuss.
Sam.
All right.
All right, bro. All right,
Thank you
peace.
so much.
All right, good.
Bye bye.